I've learned to get exceptional results in that patient population. I've published a lot of papers you can find on my website, wheltonmethods.com, L-T-O-N methods.com. The kicker is I do the same thing with everybody. So I use my protocols in here. Those are my orthopedic protocols. Since then, I'm not worried about carpal tunnel patients coming in. I'm not worried about it. I just use my protocol. Number one, it has to be safe. And number two, it has to work. I just learned what was wrong with my patient and what to do about it. Okay? So that's very important. It's very important that you get an accurate diagnosis for carpal tunnel. Yo, everybody, what's up? Physical therapist Dr. Ryan Whelton coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I got a clinic where most of my patients come in frustrated. They've tried all kinds of people that nobody knows what's wrong with them type clinic, chronic pain clinic. And I've learned to get exceptional results in that patient population. I've published a lot of papers you can find on my website, wheltonmethods.com, L-T-O-N methods.com. I'll go to publications and you can read my papers and my protocols, a lot of which I do in here. And I also have a bunch of courses. So I have my Rehab results course, which is my protocols that I use. The kicker is I do the same thing with everybody. So I use my protocols in here. Those are my orthopedic protocols. And then I have my myofascial course, which I wrote a paper on that, like 10 years ago. And I wrote in there that I wrote in the paper that these points that I outlined, that I mapped at certain joint angles and angles of pressure, act as instant reflex pain points, meaning it shuts pain off instantly in the cases that I outline in there. Anyways, if you want to take my courses, that's my myofascial courses, and that's on my website. And my intro shoulder course for the myofascial course, I offer money back guarantee. If you can't relieve the pain of the majority of the people that you attempt the method on, we'll give you your money back. No questions asked. So I've had that guarantee for like a decade and people love it. So anyways, there's that. And then I have my sciatica cervical radiculopathy, which is a similar set of points as my myofascial courses, in a similar mechanism, if you will. It provides relief for majority of my patients I attempt it on. And then I have my business course where I teach people how to open and run a business like mine, non-insurance-based business. And I have my membership, which I started, and I'm teaching live in there now. You join my school group, go to become a VIP member in the drop-down menu at wheltonmethods.com, W-H-E-L-T-O-N, methods.com. And you can join my membership, and then you can come to my free teachings. So I teach live with live Q&A online. So if you have questions, over the years, a lot of people had questions for me. They call my office, they message, they email. I got a patient with this or that or whatever. This is where we discuss it. So an amazing community of clinicians like us that are forward-thinking clinicians that want to break the mold and get better results. So my goal is to get us up here diagnostically and also treatment-wise. That's my goal with the group. And I can't wait to meet you all. I've been, responding to comments for years, but I've never met you. So we'll have a chance to meet. So join it. It's free. School group. Go to my website, become a VIP member in the drop down. Okay. Today, I am talking about I've just published a paper. It's called Root Cause of Carpal Tunnel Syndrome. Okay. And in that paper, I propose that carpal tunnel syndrome is caused based off of the 19 cases in there, 11 patients, 19 cases, bilateral. And I propose in there that carpal tunnel syndrome is caused by a tight posterior wrist capsule. So years and years and years ago, I was working with a patient, and I'll never forget it. I was working with a patient, and I was like pulled up right next to her, and she had carpal tunnel syndrome. And I wanted to know what was causing it, right? So I started playing with her wrist. I'm like, where's this coming from? Like, what's compressing this tunnel, So I started playing with her wrist, and I started to notice that she had a tight posterior wrist joint capsule, okay? And I'm sitting there, and I'm like, okay, well, maybe this is causing it, right? So I started to mobilize her wrist joint and then do a protocol that you can find on my website in my paper or my Rehab results course. And I started to, these patients started to get better, her and subsequent patients after that. So that was probably 15 years ago. And since then, I'm not worried about carpal tunnel patients coming in. I'm not worried about it. I just use my protocol, and I've never tried on a severe case where the person had atrophy, but in the paper I detail that mild to moderate cases with the sensory issues and pain, all that stuff, that I've used it with great success. So anyways, I recommend you share that with everybody you know. Clinically, pin it to your break room and help your colleagues, help them. It can be stressful in the clinic. You got Mrs. Jones, sitting there asking you to, like, why am I not getting better type thing. I know the feeling. You sit there, you feel helpless, you don't know. But, if you use these protocols, I believe it'll make it less stressful for you, because you're like, okay, got this, right? So one of the things that I outline in that paper is I modified Phelan's test. So everybody knows Phelan's test, right? It is a great test. I will tell you that I love that test. And you hold for a minute, and if the person has carpal tunnel, this finger, this finger, this finger, and sometimes the inside of this finger will have sensory issues. And after, you have the patient hold for a minute and they start to have the sensory issues, then it's carpal tunnel. Now, what can be very tricky is when a person has, like, let's say a herniated disc that's causing nerve pain down their arm. Let's say the person has nerve entrapments, right? And it's causing nerve pain in their hand. Maybe they have thoracic outlet syndrome, which is usually the whole hand, but let's say they have thoracic outlet syndrome. The question is Phelan test right? Is there a more specific way? Now, further research would need to be done on my proposal in that paper on modifying Phelan's test, but I've done this clinically. And once I started to pin down with my patients that it was a tight posterior capsule, right? One day I had a person in a Phelan's test, and I wanted to know so they had symptoms in their three fingers right here. And then what I did is I did a posterior mobilization, a wrist joint capsule mobilization. And I went like that. And while they were in this, I grabbed here and here and did a joint mob. And I held it for, 10, 20 seconds, something like that. And I said, do you still feel those symptoms in here? And I would say, I don't have exact numbers, but I would say 50%, maybe somewhere around there, 50% of my patients were like, yeah, no, it's gone. And I'm like, well, that further confirms that this was carpal tunnel, So I was like, so it was very helpful to me to modify that, because you don't know what's coming from here. They go like this, they pinch a nerve in their neck, but then they feel it in here. You know what I'm saying? So it's very helpful to exactly know, okay, well, if that relieve their pain when I mobilize the wrist joint capsule, like I always say, that, okay, so then when I create that and I mobilize the wrist joint capsule like that, it relieves their pain. So I just learned what was wrong with my patient and what to do about it, okay? So that's very important. It's very important that you get an accurate diagnosis for carpal tunnel. Like I said, Phelan's test is a great test, but I think I just made it, higher specificity with the diagnosis when you add on my twist to it. Give it a shot. The only way we know is to give it a shot. So there's a lot of publications and a lot of theories and a lot of this and a lot of that. But if you just try it, you'll know. There's most of this, all the stuff I teach, I don't teach things that hurt people. Number one, it has to be safe. And number two, it has to work. Like, I'm not interested in fluff. I'm not interested, oh, well, maybe this helped a little bit or whatever. I'm like, what's the root cause? What do I do to fix it? How do I get the person out of pain immediately? You know what I'm saying? So that's how I work. So the things that I do are very, very practical. Meaning, like, if you've read my SI paper, it's pretty practical. You can just test right then and there. If you read my sacral paper, I made that very practical. My plantar fasciitis paper, my shoulder paper, and now this paper. So everything I do is very practical, and when it comes to diagnostics, which I will go over, in the membership group, I'm not comfortable with a positive NIRS test to say that somebody has a shoulder impingement syndrome. What I want to know is not that they have a positive NIRS test, is when I mobilize the humeral head posterior and inferiorly, does the NIRS test go from positive to negative while they hold it up there? And if it goes from positive to negative, then not only did I just prove that the person had rotator cuff impingement, but I just proved to myself what I needed to do to fix the problem, get it posterior inferior like I outlined in my shoulder paper. So that makes you an accurate diagnostician. You know what I'm saying? It's like being an MD where you're just guessing in the clinic and you have like a history versus, oh, I got the blood test back, you have high cholesterol. Oh, okay, well that makes sense. You have the blood test right there. You know what I'm saying? It's more objective, to me. So this is really, really important that in my opinion, you learn to diagnose this way, because if you don't, then you're going off of suppositions, like, oh, well, the person's pointing to their SI joint, but I don't know, it could be not, but what if you realign the upslip, open the out flare, and their pain relieves immediately? Well, now you know that it was SI joint dysfunction caused by an upslip and or out flare. You know what I'm saying? So when you do it this way, you confirm to yourself and you take the stress out of it. You take the stress out of it. You take the stress out of what's wrong with the person, where you have that hamster wheel in the back of your head. Do I have the right diagnosis? Am I missing something here? Is this person going to get better? My goal in publishing papers and teaching was to help people. So to help people get better and help people get better at diagnostics, but also treating, and to take the stress out of helping these people, So when it comes to carpal tunnel syndrome and you do Phelan's test, try a posterior glide, okay, of the wrist joint, okay? And some people will say, yeah, no, that when you hold it there, my carpal tunnel symptoms go away. Boom, you got it. The posterior capsule was causing compression and pushing the carpal bones into the tunnel. And now you know. Now you know that they have carpal tunnel syndrome, but you also know that it's caused by its tight posterior capsule pushing it into the tunnel. Okay, so that is how I recommend you diagnose that, and it helps you with all the other things that can go on where that can mimic the symptoms of carpal tunnel. Okay, and maybe they got both. Maybe they got a C6 herniation, right, and carpal tunnel at the same time. Maybe this relieved part of it, in there, but they still got radiculopathy in here from a C6 herniation, right? Okay, well, now what I would do is I would put them on my carpal tunnel protocol. I would put them on my herniated disc cervical protocol, and I would make sure that I address all of the things. Sometimes when I treat, I'm usually historically pretty accurate, and I know with what I just talked about in terms of like, okay, I got the person out of pain, tells me exactly what's wrong. But if there's a question mark in my mind, whether it's coming from the neck, I don't have MRI vision. When it's coming from the neck or coming from the hand or coming from, whatever, nerve entrapments, sometimes I'll put them on both protocols, and just as a prophylactic type thing. It's not going to hurt them to strengthen their stretch here and strengthen back here, fix their posture to relieve, strength. Most people, if you look at them, they're like this anyways, right? So it's not going to hurt them. So, sometimes that's what I do. I always say with my SI protocol, put every patient from lower thoracic to into the foot in my SI protocol, okay? Because if it is SI, let's say you disagree with the doctor. Let's say, which I see all the time in here as patients that are diagnosed with, told it yesterday, herniated disc, that's the reason why you have back pain and pain down your leg, right? They did the MRI and everything. Patient wasn't getting better with anything else. So what I did was I opened up their SI joint and boom, their SI joint referred pain chart went away down their leg and their back pain went away, which is the great imitator of sciatica, SI joint. And I was like, yeah, no, this is SI joint. This isn't, you have a herniated disc. Nobody's arguing that. It's on the MRI, but it's not the source of your pain. Now, I get it. A lot of you work in clinics where you got to, follow whatever they tell you to do. Okay, here's a diagnosis coming from the MD, but let's say you disagree, right? And if you speak up, you can get fired for that. I get it. I get how that works. So what you can do is put them on my SI protocol as part of your treatment plan for the herniated disc. Just put them on my SI protocol. It's not going to hurt them, And some people strengthen those muscles anyways for a herniated disc. So I recommend that's what you do. You do prophylactic type treatments where if you're not sure. But in my membership, which you should all join, go to my VIP Inner Circle, WHELTON, wheltonmethods.com, and sign up. My goal is to get us up here diagnostically. I'm going to teach you how I do this, how I diagnose, and how I make sure that my diagnosis is on point. Okay? Other than that, that's that. Go read my papers at wheltonmethods.com, WHELTON methods.com, and I will see you in my membership community. Can't wait to meet you. Peace. Love you all.